Hello everyone, this is Clinical Group G and our community project focused on Bay County. Bay County is made up of 14 townships and 4 cities, with a total area of 631 miles made up between water and land. The population currently consists of 103,126 people and is divided into various races and ages. This is the 20th most populous county in the state of Michigan. Our community survey was conducted by completing a windshield survey where our clinical group drove around different cities located within Bay County. We visited Pinconning, which was more of a rural area, the Bay area, which consists of Bay City and Essexville and is considered to be metropolitan but also consists of farmland, Caucalan, and Auburn, which are also metropolitan but have farmland as well. As you can see, housing was one of the categories recorded during our windshield surveys. If you read more into this slide, you can see specific information about each area's housing. Due to COVID-19, our clinical experience was a little unique this year. We did both in-person visits and Zoom calls with various organizations. 2 places that we were able to visit in person was St. Mary's Flight Care Nursing, where we learned about the education involved in the process of becoming a flight care nurse, and Highland Pines, where we were able to provide care and interact with students who need highly concentrated special education and therapy services in a school setting. The organizations that we met with over Zoom consisted of the Bay County Health Department, the Good Samaritan Rescue Mission, and the Bay Area Women's Shelter. The photo of the t-shirts on the bottom of this slide was something that we learned about in our Zoom call with the Bay Area Women's Shelter. Each t-shirt represents a different victim of abuse, and information regarding that abuse is provided on this slide. The main goal of this project is to bring awareness to resources and problems in the community, as well as to support a resource in the community. The next few slides will outline the concepts that affect Bay County and demonstrates how they are all related. Different factors play a role in making individuals vulnerable. Economic status, health, addiction, violence, and a growing elderly population are major factors that we found to make Bay County vulnerable. As you can see by the statistics provided, women make up a majority of individuals in poverty. Chronic disease is the leading cause of death here, with heart disease being number 1. Addiction is a problem, and there is a high rate of domestic abuse. To touch on addiction, Bay County adults that sought treatment for opiate addiction in 2014 was 48%, compared to 15% in 2005. To address the high rate of domestic violence in Bay County, this county has a higher state of domestic violence than the entire state of Michigan. The elderly population is also growing, and in 2016, 20,000 people that make up this population were 65 or older. This slide is comprised of resources for some of the vulnerable populations within Bay County. Bay County Veterans Affairs, as well as Sacred Heart Rehabilitation Services, serves the veteran population within Bay County. Bay Aranac Behavioral Health and Sacred Heart Rehabilitation Services serves those suffering from drug abuse and opiate addiction. The ARC of Bay County and Do All Inc. support the disabled community within Bay County. The ARC offers many resources and levels of advocacy for disabled persons in this area with a focus on educational advocacy. They assist families with their students' needs in navigating the school system and achieving the appropriate support for a successful school year. Do All Inc. provides those with disabilities the opportunity to lead self-sufficient lives. They give them opportunities to volunteer and do work that prepares disabled individuals for the workforce later in life. Within Bay County, statistics are kept on live births, abortions, estimated miscarriages, and even sexually transmitted diseases. More specifically, these statistics are separated into different age groups. For example, teen females in Bay County counted for 62 pregnancies in 2019. Reproduction services in Bay County include the Personal Health Family Planning Clinic and Maternal and Child Health Services. Both places offer resources and tests, as seen in this slide, to keep women, men, teens, and even children's reproductive health monitored. Bay County is a predominantly white community, with 5.5% of its population being Hispanic or Latino and only 1.8% African American. There is a large elderly population, with 21% of the population being 65 or older, and there are also over 7,500 veterans in this community. A few resources to support the diverse populations in Bay County include Bay City Solidarity Facebook page for African Americans, Great Lakes Bay Pride for the LGBTQIA+ community, Meals on Wheels for the elderly community, and Disability Services Resource Center for those with any disabilities. As of November 28th, there were 4,125 COVID cases and 89 deaths. The top 3 causes of death within Bay County as of 2018 are heart disease, which was previously mentioned, cancer, and chronic lower respiratory disease. Resources in Bay County for COVID-19, cancer, and more include hotlines, the United Way of Bay County, the Bay County Foundation, American Cancer Society, Bay County Health Department, and the Michigan Department of Health and Human Services. Bay County does not have a lot of statistics regarding violence. This is probably in part due to underreporting, but a statistic to note is that Bay County has higher assault and rape averages than the national average. There are many resources that support victims of violence, including Adult Protective Services, the Good Samaritan Rescue Mission, the Bay County Health Department, and the Bay Area Women's Center. Some important aspects within Bay County that concerns growth and development would be the amount of dollars that are spent on the WIC program yearly, and other statistics include the low birth weight, teenage mothers, and rates of education levels in childhood years. Some of the many resources in Bay County having to do with growth and development would be the WIC program, which is located within the Bay County Health Department, the Good Samaritan Rescue Mission, Children's Special Care Services, the Maternal Infant Health Program, and the Bay Area Diaper Bank Pantry. Health promotion can be separated into 3 levels of prevention, which include primary, secondary, and tertiary levels. The 3 resources that have been provided are the Bay County Health Department, the Bay Diagnostic Center, and Sacred Heart Rehabilitation Center. To supplement the health promotion resources provided, here are some health promotion statistics from Bay County. These statistics include vaccination rates, breast cancer rates, and drug abuse. Some important disasters that occurred within Bay County are COVID-19, drug overdose, and flooding. So far, 4,600 people have gotten infected with COVID-19 and 1,500 became positive in November. The main drug seen that people are overdosing in is opiates. In the last 2 years, the Bay City Public Safety Department has responded to 154 overdose calls, with 19 deaths. Lastly, Bay County was also very close to the Midland flood and had to shut down 40 roads. This slide has resources that are available to people when disaster occurs. These resources can help people get tested for COVID, find housing options that are affordable, get access to mental health needs and services, and get assistance to gain employment. The organization that our clinical group decided to serve was the Good Samaritan Rescue Mission located in Bay City. They are an emergency shelter that helps to guide their homeless population to meaningful and sustainable permanent housing solutions. Resources provided by this rescue mission are temporary shelter, food, clothing, hygiene products, help with finding a job and more permanent shelter, and these individuals are given spending money and a savings account. 10% is for spending and 90% is saved so that they are able to afford housing when they are discharged from this service. This organization serves men, women, and children, and they recently opened a new wing for juvenile runaways. Because the rescue mission is currently accepting non-perishable food donations, our clinical group decided to partner with them and host a socially distant food drive. We contacted Jill Baer, who is the organizer of volunteer services and education, and Brian Pike, who is the kitchen manager. Our group gauged their interests, the mission's needs, and used their needs list, which can be found on their website. We then designed this flyer and shared it on social media and gathered donations by picking up items or having items dropped off at our homes to maintain social distancing. Our entire clinical group worked together to decide which organization we would serve and how to do so. The group also collaborated on this presentation. Kayla, the girl in this picture, reached out to Jill Baer and Brian Pike via email to coordinate the food drive and donation drop-off because she lives in Bay City. Mickayla, Maddie, Austin, Rachel, and Kayla shared the flyer since they live in or near Bay County. Maddie, Austin, Rachel, and Kayla collected donations because they live in or near Bay County. And Kayla collected the donations from the community members and clinical group members and dropped off the donations as seen in the photo on the right. This project benefited the community because we provided non-perishable food items and benefited the members of the community that seek shelter there. The community members are well fed, good hygiene is promoted, and safety and overall well-being is maintained. This shelter cannot run or exist without the funds, clothing, hygiene products, and non-perishable food items that are provided. And helping the people that live there is helping local community members. During the community project, our group did a good job of keeping everyone safe during COVID-19 and accommodated with no contact precautions. We did our best advertising the donations on social media, but it would have benefited us if we could have started sooner. That way we could have posted on whiteboards and asked professors if they would have liked to donate while we were still in-person classes. The community diagnosis that we developed from our research and experience in Bay County would be a health status issue. There is a lack of access to healthcare services. Nearly 1/4, or 21% of the population, has reported not having a routine checkup, which is concerning because this can contribute to preventable hospitalizations that only increase the cost of healthcare expenses for patients. It would benefit the Bay County community to represent the minorities in the community and do more to support them. They should also implement programs to help reduce drug overdoses and death, and create an official adult daycare facility for the students at Highland Pines who are older than 26. For those of you who do not know this, the disabled individuals that attended Highland Pines are released from their services at the age of 26, and there is nowhere within this community to help them during the day. That is why we suggested that they establish an adult daycare. Some beneficial community interventions would be to begin cultural education programs to address the diverse community of Bay County. They should also address the drug overdoses within Bay County and suggest starting a street nurse program. Lastly, to address the lack of healthcare services, we suggest that the Bay County Health Department go out into the community and set up a tent where they could do quick health routine checkups and provide immunizations in a location that is easily accessible by public transportation. Thank you for tuning in to our community project presentation.